US with more than 216,000, Brazil close to 151,000, and India more than 110,000. States are getting ready for what looks like the inevitable, a second wave of COVID-19. In Pennsylvania, the Department of Health prepares the state for an anticipated COVID-19 resurgence. In Swarthmore, Bureau Chief Myla Simbulan joins us this evening. Myla.
Thanks, Ace. For months, the government of Pennsylvania has been preparing for a possible fall resurgence of COVID-19. Plans are in place and teams were created to make sure all Pennsylvanians are protected as possible from both COVID-19 and influenza. Now that fall is here, what is the next step? Here's Pennsylvania Department of Health Secretary. Take a look.
We've been working very hard during the last several months to prepare for a potential fall resurgence of COVID-19. Today will mark the 9th day in a row with our daily case counts reaching more than 1,000 new cases per day. As of midnight, we are reporting 1,276 additional positive cases of COVID-19, which brings our statewide total now to 175,922. We are also tragically reporting 27 additional deaths associated with COVID-19, which brings our total to 8,411. We have 773 patients currently hospitalized, with 83 patients either on a ventilator or receiving a treatment called ECMO, ECMO, with a ventilator.
One of the keys to stopping the spread of COVID-19 is expanding access to testing. A quick and dependable test is critical, especially for those who are asymptomatic. The earlier detection that someone is infected with COVID-19, the better. Here's Pennsylvania Testing and Contact Tracing Director Michael Huff to tell us more about the Commonwealth's plan for testing. Take a look.
To complement our public health mitigation efforts, the federal government is allocating 150 million Abbott Buy Next Now antigen rapid tests. The federal government, through Abbott, will directly ship 50 million of these tests across the U.S. to personal care facilities, skilled nursing facilities, historically black colleges and universities, home care and hospice organizations, and Indian Health Service. Of the 100 million remaining tests, Pennsylvania is being allocated on a per capita basis over 3.8 million Abbott Buy Next Now antigen rapid tests from now through the end of December. The Pennsylvania Department of Health has already received the first allocation, and shipments of 250,000 tests will continue weekly until the end of December. In addition, the Pennsylvania Department of Health, in partnership with PEMA, is responsible for the distribution, administration, and reporting of the test results.
The Health Department announced earlier today that the first allotment of rapid antigen test cards are being distributed to several counties that are seeing increased cases of COVID-19 across the state. These test cards provided by the federal government and the state will be distributed to certified institutions, including long-term care facilities, personal care homes, assisted living facilities, intermediate care facilities, higher education institutions, drug and alcohol and behavioral treatment centers, correctional facilities, and other health care providers in these counties assist in rapid testing in these communities. As cases have increased, a team of staff is working to assess where outbreaks are occurring. This includes surveillance of congregate care facilities like long-term care facilities, college and university campuses, and prisons and jails. The department also has been working to assist in areas where there are outbreaks and to provide resources. These resources may include infection control expertise, connection to testing resources, and working to assist stakeholders with questions. The department also is preparing for the distribution of a COVID-19 vaccine. Once a safe and effective vaccine is developed and approved, the department has been working closely with the Centers for Disease Control and Prevention, or CDC, to plan for the distribution of the vaccine when it becomes available. Early on, there may be a limited supply of vaccine distributed in a phased approach. The department plans to ensure the limited vaccine is distributed to the highest priority populations in a timely manner. The department has been working with a number of stakeholders within and outside the Wolf administration, including county and municipal health departments, federally qualified health centers, educators, pharmacists, physicians, and the Veterans Administration in preparation for vaccine distribution. In Swarthmore, Pennsylvania, Myla Simbulan, Eagle News, we live in interesting times. Back to you, Ace.
Thanks, Myla. As a resident of Pennsylvania, what do you think are the things you need to do to help stop fall resurgence of COVID-19?
That's a good question, Ace. So we've been following the news, especially here in Pennsylvania, and they've been telling us about this fall resurgence. So we've been aware of that months before, and that's why one of the things that we prepared for as a family is flu vaccine. So all of us already had flu vaccine, and also now that this fall and it's getting colder, whenever I go out, I make sure that I wear a mask. But not only that, I added another layer on the mask, like so that, you know, especially when I go to grocery stores, it will be more protected. Also, we try to avoid going to crowded places. Before, we're okay going every now and then in restaurants, but we'll probably this fall season and even winter, we will try to avoid going to restaurants, especially if they're crowded. Ace?
That's right. Well, thank you so much, Myla. It is indeed not just the government's responsibility, it's everyone's responsibility. We just have to take care of ourselves and take care of others as well. Thanks for your report, Myla.
Thanks, Ace.
In these times when everyone is very vulnerable to getting sick, the state of New Jersey launches Get Covered New Jersey, a state-based health insurance marketplace. In Sicklerville, May Ann Manzano-Guerzon has the details.
Thank you, Ace. In a report released by the Executive Office of Governor Phil Murphy, the governor announced the launch of the state's official health insurance marketplace, Get Covered New Jersey. It is now open to residents to browse health plans, compare prices, and find out if they may qualify for financial help ahead of the Affordable Care Act open enrollment period that begins November 1. New Jersey residents will no longer use healthcare.gov to enroll in marketplace health insurance plans. Instead, marketplace plans and financial help will only be available through Get Covered New Jersey at getcoverednj.gov. Get Covered New Jersey provides a one-stop shop for health insurance for residents who do not have coverage from an employer or other program. It is the only place residents can get financial help to purchase a plan. This open enrollment, more financial help than ever before is available to eligible residents shopping on state marketplace as a result of new state subsidies passed by the legislature and recently signed into law by Governor Murphy. Governor Murphy said that his administration has fought for improved access to quality, affordable health coverage for residents based on the fundamental principle that health care is a right. The coronavirus pandemic has underscored the need for all residents to have health coverage, and there is no more important time than now for for New Jersey to make the transition to its own healthcare insurance marketplace. The subsidies will help reduce health insurance premium for new enrollees and those with existing health plans through the federal marketplace. The subsidies will start lowering premiums for coverage that starts January 1, 2021 or after. Residents currently enrolled in a health plan through healthcare.gov will be automatically transitioned to Get Covered New Jersey. Residents can go to Get Covered New Jersey now to start browsing health plans and prices and get an estimate of how much financial help they may qualify for in 2021. They can also learn if they may qualify for NJ Family Care, the state's publicly funded health program offering free or low-cost coverage through Medicaid and the Children's Health Insurance Program. For more information on Get Covered New Jersey, visit getcovered.nj.gov. Meanwhile, here is today's statistical report of New Jersey's COVID-19 cases. According to the Department of Health of New Jersey, we have 953 new positive cases, bringing a cumulative total of 216,023 New Jerseyans tested positive. Sadly, we have 9 new deaths, pushing the total to 14,402 lives lost. New Jersey remains on stage 2 of its road to recovery. And for some weather update is, it's now 9:51 in the evening here in New Jersey, and it's currently clear. It is 53 degrees Fahrenheit or 12 degrees Celsius. The high today was forecast as 71 degrees Fahrenheit or 22 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to you, Ace.
Mayan, before I go, what is the coverage of the plans offered through Get Covered New Jersey?
Ace, all plans offered through getcovered.nj.gov cover the 10 essential health benefits required under the ACA, including preventive services, emergency services, prescription drugs, and prenatal and pediatric care. And no one can be denied coverage due to pre-existing condition. Ace?
Thank you so much, Mayan.
Thank you, Ace.
Amelia Chaz Elsevar is appointed Chief of Staff to Maryland Governor Larry Hogan, making her the first woman to hold such an office in the state. In Gaithersburg, Naya Danes reports.
Thank you, Ace. The first woman to serve as Chief of Staff to a Maryland Governor, Amelia Shazvar, was appointed as Chief of Staff by Governor Hogan on Tuesday. Shazay Elsevar has worked in the Hogan administration since 2016 as Deputy Communications Director from 2016 to 2018 and Director from 2018 to 2019. Elsevar has also held positions with Texas Governor Greg Abbott, America Rising PAC, and John McCain's presidential campaign in 2008. Hogan commends Elsevar as someone who brings to the table a deep knowledge of our administration's priorities and a management record of results that will be invaluable as we continue to change Maryland for the better. Shazay Elsevar will replace Acting Chief of Staff Kiefer J. Mitchell Jr. Mitchell will resume his position as Chief Legislative Officer and take on a new role as Hogan's Senior Counselor. Mitchell took over as Acting Chief of Staff in August after the resignation of Roy McGrath, who resigned after reports revealed that he received an immense package before taking on his new role as Hogan's Chief of Staff. Amelia Shazay Elsevar's term as Chief of Staff is effective October 20th. Elsevar says, "Now it's time to roll up our sleeves and get to work to support the governor's bipartisan record of protecting the health and safety of our families and our schools, strengthening our economy, and delivering for Marylanders." In Gaithersburg, Maryland, Naya Dames, Eagle News, we live in interesting times. Back to you, Ace.
Naya, one more question before I go. What was Elsevar's reputation as communications director for the Hogan administration?
Well, Ace, it's interesting to note that Elsevar left the Hogan administration for the Republican Governors Association, the RGA, when short in Hogan's re-election over Democrat Ben Jealous. along with Alcivar as communications director, ran a negative campaign against Jealous, which could have been a deciding factor in Hogan's re-election. Ace?
Thank you so much, Naya. When we come back, updates from our Eagle News correspondents in Seattle, Washington, Pasadena, California, and business news with Bobby Soriano. This is Eagle News America. Stay with us.
It says the best defense is still containment.
We are in uncharted territory.
Final volume 450. The fire mo to 100%. Traffic ban. Construction eh.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
Talagang napapawawa ko.
Yung performance mo was very powerful. Ang linis ng galaw.
Grabe yung connection nyo. As in, para kayo nagbabibrate papunta sa akin.
Papatunayan ng ating mga kalahok na when it comes to dancing, ay hindi laging totoo ang phrase na strength in numbers. It's their solo mission to own and dominate our TNG stage with their unique style. This is Tagisan ng Galing Part 2 Dance Edition.
You're watching Eagle News America. I'm Ace Ramirez in Washington, D.C. COVID-19 has brought social and economic damage to our communities. In Washington State, Governor Jay Inslee introduces a new state effort to help people recover. In Seattle, Bureau Chief Renvel Fejeran reports.
Thank you, Ace. Before we get into the new group that was established here in our state, allow me to give you the numeric COVID-19 status. Currently, we have 94,775 confirmed cases, 7,874 hospitalizations, and sadly, 2,211 deaths. As you can see, COVID-19 is very much alive here in our area. As the coronavirus continues to penetrate our communities, the state government continues to come up with ways to combat the disease and to rebuild what has been destroyed, like our economy. So during the recent press conference, the governor announced a new state effort to help the counties and communities recover from the social and economic damage by COVID-19. This new group is identified as the Washington Recovery Group, organized with sole intent to fortify our state's recovery endeavors. This group will be at the disposal of state agencies to help them coordinate with local governments, higher education, and the private sector. In Governor Inslee's words, COVID-19 has tested our state in many ways, and each crisis is a learning experience. While local governments, businesses, and our agencies have made heroic efforts to protect and care for our communities, this crisis highlights gaps we need to close in our emergency recovery efforts and long-term rebuilding efforts. This new group will help state agencies change how we do business so that we can better serve the people of Washington. State agency experts will be collaborating closely with local stakeholders and tribal partners to effectuate restoration solutions and pathways. The solutions will be presented to cabinet agencies and the Office of Financial Management. What will be the focus areas of this new group? Community and social services, education and childcare, employment and jobs, equity and social justice, health and healthcare, housing, infrastructure and energy, and support for small businesses. As part of Governor Inslee's press release, a few examples of our economic situation at this time are as follows. The state's unemployment rate had shot through the roof from a record low rate of 3.8% back in February to more than 16% in April, when about 650,000 Washingtonians were out of work. The unemployment rate remains more than twice as high as it was in February. Also, state revenue collections also took a hit. April retail sales tax receipts falling 20.8% compared to the same period a year ago. Revenue collections have begun to rebound, but the state will still faces a significant projected shortfall in its next two-year budget. Also, the number of participants in temporary assistance for needy families rose from fewer than 56,000 in February to more than 72,000 in May. And basic food program participation outside of food bank visits increased nearly 18% between February and July. So the Washington Recovery Group will be based out of the Office of Financial Management and will partner with the Emergency Management Division of the state's military department. The Washington Recovery Group will be holding their first meeting later this month. So it's really exciting to see who makes up this group and how things will begin to unfold with this new group. Governor Inslee remains hopeful and confident that with this group, the state will benefit as a whole. Seattle, Washington, Friends Alpha Heron, Eagle News. We live in interesting times. Back to you, Ace.
Frendel, I understand Washington State has multiple agencies collaborating in the COVID-19 response efforts. What does the Washington Recovery Group offer that would set them apart from other groups?
Thank you so much for that question, Ace. So the Washington Recovery Group, what sets them apart is that their focus is going to be mainly on the economic portion. So they're going to change how the state does business, and it's going to they're going to connect agencies together with their stakeholders in the most efficient and effective way. Ace?
I see. All right. Thank you so much, Frendel.
You're welcome.
Businesses in Ventura County will reopen for indoor operations, provided they comply with strict safety protocols set out in the state's health orders. In Pasadena, Eli Austria reports.
Thank you, Ace. Ventura County, which neighbors Los Angeles, moves to Tier 2 and reopens businesses. The Ventura County Health Officer announces that more businesses can reopen, including movie theaters at 25% capacity, as the county moves to Tier 2 of California's health order system, which is a four-tiered county tracker and guiding blueprint in the reopening of the different business sectors for indoor services in compliance with the required safety protocols. With the approval to reopen businesses, coupled with abiding by physical distancing regulations, Ventura County has become the 18th AMC movie theater location in California to reopen after the temporary closures since the COVID-19 pandemic began in March. According to AMC, more than 500 of AMC's approximately 600 theater circuit should be operational by October 16th. In Ventura County, AMC Dine-In Thousand Oaks 14 can expect the company's popular AMC Dine-In delivery to seat model. Guests can place their order at the food and beverage area in the lobby from an expanded menu, and then head into their auditorium where their food is delivered to their all-new AMC signature recliner. With the pandemic and fear of spreading the illness at the forefront of many consumers' minds, AMC CEO Adam Aron commented, quote, "It's encouraging that we continue to make progress opening theaters in California and in the key Los Angeles area market. We continue to reopen responsibly. The feedback we've received from our guests indicate that our AMC Safe and Clean policies and protocols are working exactly as intended. We're seeing record high guest scores for the cleanliness of our theaters, far exceeding the marks we've received in the decades we've been tracking guest feedback. AMC Safe and Clean is the cornerstone of our efforts to woo back moviegoers to cinemas. Our AMC Safe and Clean protocols feature social distancing, mandatory mask wearing, the easy availability of disinfecting wipes and hand sanitizer, along with high-tech solutions like electrostatic sprayers, HEPA vacuums, and enhanced air filtration through MERV 13 filters, as well as numerous other new safety and cleanliness procedures. In Pasadena, California, Eli Austria, Eagle News, we live in interesting times. Back to you, Ace.
Eli, besides movie theaters, what else can residents in Ventura County look forward to now that the county has moved to Tier 2 of California's health order system?
Right, so Ace, moving into Tier 2, or as they call it, Red Tier, Ventura County is also allowing the reopening of indoor personal care services like massage salons, indoor shopping malls at 50% capacity, indoor retail stores at 50% capacity as well, indoor dining at 25% capacity in restaurants, and indoor gyms at 10% capacity with 12 feet required physical distancing. So for those who plan to work out in the indoor gyms, there has to be at least 12 feet social distancing space between you and the next person, which is a requirement of Ventura County itself. Ace?
Thank you so much, Eli Austria in Pasadena, California.
Thank you.
For today's business news, Eagle News Business Desk correspondent Bobby Soriano joins us this evening. Bobby.
Good evening. U.S. markets have closed for the day. Here are your latest business headlines. The largest movie theater chain in the world may very well run out of money by the end of the year. This was a statement made by AMC Entertainment Holdings yesterday as the chain continues to burn cash at an unprecedented rate. Continued restrictions on movie theater gatherings, particularly in large markets such as Los Angeles and New York City, have hampered AMC's ability to recoup its losses. This on top of the fact that many movie studios continue to push back movie release dates or offer their movies to streaming platforms has forced AMC to begin selling off some of its low-revenue locations in hopes of surviving to next year. The statement from AMC comes only a week after Cineworld made the announcement that it would be suspending all U.S. operations at least through the end of the year. Global public debt is expected to reach all-time highs due to the coronavirus pandemic. These are the findings published today from the International Monetary Fund, the organization tasked with fostering global monetary cooperation. In its semi-annual fiscal monitor report, the IMF reported that 11.7 trillion, or 12% of all global output, has been committed to fighting the pandemic as of the middle of September. This is expected to increase global budget deficits by 9%, with cumulative public debt approaching 100% of global GDP. Vitor Gasper, director of IMF's Fiscal Affairs Department, said in a press conference that the fiscal action taken by the authorities around the world is truly unprecedented and decisive, and extremely important in avoiding a financial and economic collapse. Mr. Gasper also stressed that while debt levels continue to grow to fight the pandemic, governments should not quickly pull back on providing fiscal support to their economies, as it could lead to long-term economic damage. Earnings results today once again focused on the financial industry. Goldman Sachs easily beat expectations this morning, proving that even during a pandemic, the investment bank has a solid understanding of today's economy. Bank of America also reported profit in line with expectations, but also noted a drop in most of its revenue streams. Wells Fargo also reported a weaker than expected third quarter, as it continues to deal with remediation costs tied to its 2016 scandal. In the healthcare sector, United Health Group, the largest healthcare company in the world by revenue, posted stronger than expected third quarter earnings, but reiterated that its 2021 outlook is still uncertain due to coronavirus risks to its business model. Lastly, in the travel industry, United Airlines follows the results from Delta yesterday, with losses greater than expected. U.S. indices closed in the red today after Treasury Secretary Mnuchin's remarks early in the afternoon, indicating that any large-scale stimulus package would be difficult to pull off before the election. Reporting from New York, Bobby Soriano, Eagle News, we live in interesting times.
When we come back, a virtual roundtable discussion about how we can help stop bullying in observance of National Stop Bullying Day. This is Eagle News America. Stay with us.
Bye-bye!
Bye-bye! Bye-bye! Gustong-gusto ko yung fake news. Bakit di nila makukuha yung tamang sagot?
Bawal ang fake news. Bawal mali-mali.
Tonto ako sa fake news, hindi nila makuha yung tamang sagot.
Team Papa Hip Hop Queen!
Ang gusto ko yung PM's the key.
Kasi nakaka-relate din ako dyan. Yung misis ko madalas umorder eh.
Ang red ba? Ang confirmed or cancel?
Gusto rin namin magbigay ng pag-asa sa ating kapwa, lalo na sa panahon ngayon.
Ang gusto ko dyan, ayudawan, nakatulong na, nakakatawa pa.
Driver Grab, nag-deliver, Driver Grab.
Ang gusto ko po dyan yung ayudawan kasi marami pong natutulungan na tao.
Salamat po. Maraming salamat po unang-una po sa ama.
Maraming salamat po. Ikwento ko po ito sa aking mga anak.
Gusto ko sa happy time, maalis tayo. Tuwang-tawa kay KitKat.
Iyan o.
Iyan o.
Oy, ano nami-miss mo sa akin?
Una sa lahat, yung napakabangong, napakabangong kabanguhan mo. Yun ang unang nami-miss ko. Malayo ka pa lang, naaamoy na.
Karding, nabuang ko sa imo dong.
Sa'yo, Karding. Oo nga, nami-miss ko na nga yung paglalambing mo ng personal. Siyempre, maasikaso ka. Alam mo naman yun, inaasikaso mo ako.
Gusto mo yung binibigay ko no?
Oo.
Kumanta, sumaya tayong lahat. Kaya saya.
You're watching Eagle News America. I'm Ace Ramirez in Washington, D.C. Today is National Stop Bullying Day, and to make this day matter, our virtual roundtable discussion this evening is about how we can help end bullying. First, an overview. What is bullying? According to stopbullying.gov, bullying is unwanted, aggressive behavior among school-aged children that involves a real or perceived power imbalance. The behavior is repeated or has the potential to be repeated over time. Both kids who are bullied and who bully may have serious lasting problems. To be considered bullying, the aggressive behavior must include number one, an imbalance of power, and number two, repetition. There are three types of bullying: verbal, saying or writing mean things; social, or relational, that means hurting someone's reputation or relationships; and the third is physical, hurting a person's body or possessions. To talk more about the effects of this aggressive behavior on kids who are bullied, kids who bully others, and those who are considered bystanders, we have with us tonight Jennifer Polintan, a former licensed therapist with a master's degree in counseling. Ms. Polintan also owns a Kumon Center in New York and a parent of two beautiful, well-rounded daughters. Thank you for joining us, Jennifer.
Oh, thank you for having me, Ace.
With us tonight also is Dr. Sydney Fontenares, a licensed clinical psychologist in Livermore, California. Thank you for being here, Dr. Fontenares.
Hi, Ace. Thank you for having me.
Okay, let's dive into this. We have 3 points of discussion for tonight. According to stopbullying.gov, kids who are bullied experience negative physical, social, emotional, academic, and mental health issues. These include depression and anxiety, increased feelings of sadness and loneliness, changes in sleep and eating patterns, and loss of interest in activities they used to enjoy. These issues may persist into adulthood. Health complaints, decreased academic achievements. Could you explain Dr. Cindy, what are the telltale signs of depression and anxiety caused by bullying?
Sure. Great question. It's kind of a two-part question, because with children, depression and anxiety will look different. It's for adults. It might be a little bit more obvious. They're able to recognize, like, hey, I'm feeling low, or I'm feeling depressed, I'm feeling anxious. For kids, they might not totally recognize it straight away. Usually you can recognize it by changes of behavior. Like you've mentioned, Ace, changes in sleep, changing in eating. Maybe they're isolating a little bit more from their friends, or maybe not taking part in things that they usually take part in, maybe with playing with friends or playing with a particular toy. Those are kind of the telltale signs for depression in children. For adults, also very similar: changes in sleep, changing in eating habits, feeling a little bit more fatigue. Also, our thought patterns can be maybe what we call more ruminating thoughts, where it's kind of like our thoughts on a hamster wheel. Those are signs that are not typically red flags for us, but it's something to note if we're trying to evaluate for anxiety or depression.
Okay, so the patterns change, eating habits, joining activities. Jennifer, as an owner of an educational institution like Kumon, right? How does bullying affect the students, their education, their academic achievement? Does it affect them?
Sure, I think bullying affects them in a multitude of ways, and their education is definitely affected. Let's say that some student is being bullied, it'll affect their self-esteem. It'll make them doubt their own self-worth. They'll be consumed by thoughts of, why is this happening to me? Maybe I'm not good enough. Maybe I'm not smart enough to be able to fight back. So you start putting yourself down, and there's a lot of negative self-talk. And if that happens, that can then affect your mental stamina. That can affect your ability to concentrate. That can also affect your academic performance, because then you'll start to wonder why and start to doubt yourself, start to doubt your own capabilities and what you can do. And if they are starting to feel depressed, that'll also affect their study habits, their routine, and you'll start to see their grades start to fall. They won't be as involved or motivated to do well in school also, because they're preoccupied with what's going on socially around them. So they'll start to give up or maybe pull away from academics. So you will see their grades start to fall also.
I see. Okay, so they say kids who bully others can also engage in violent and other risky behaviors in adulthood. Kids who bully are more likely to abuse alcohol or drugs, get into fights, vandalize property, engage in early sexual activity, have criminal convictions and traffic citations as adults, and be abusive toward romantic partners, spouses, or children as adults. So really, what it's saying is there is a negative impact on the kids that are bullied and also the aggressor. Is that right, Jen? Can you expound on this?
I do think that's correct. I think bullying happens, or bullies are formed because it's an outlet for them for their own aggression. So they are taking their feelings out on other people, on, let's say, another student, another child, and it's easy for them to be volatile, to be violent, or to be aggressive towards someone else, and they're unable to deal with those negative feelings that they have. If their own anger issues, whatever problems that's going on at home, they take it out on other people. Without learning how to cope with those feelings, those intense negative feelings, they can then use other methods to cope, such as drugs, alcohol, promiscuity, or negative behaviors. So if that doesn't get resolved as a child, if they don't learn positive outcomes or ways to deal with those negative feelings, you will see it start to evolve into social patterns, personality development as they get older. So they do have to learn not only to stop bullying other people, but to learn positive ways to deal with whatever emotion they're struggling with, which is why they are acting aggressively towards others.
Okay, so talking about dealing with bullying, Dr. Sydney, how do we deal with this? On the bullying side and the bullied side, how do we deal with it?
Sure. So I would first, on the, I guess, being bullied, right? That is an important conversation because we're also seeing cyberbullying, right? Which is such a, it's such a big thing now because everyone's on the internet. So if you are being bullied, and it's kind of all across the ages, right? Even as an adult, those are when I work with patients who are in their adult years, that's kind of the narrative I see too. Like there's a history of all this bullying and like what Jennifer had mentioned, there is a lower self-esteem. There is all these other behaviors that come up because of bullying, and to be able to address it, I think is first as a system within the family, being able to talk about it. It's a hard conversation to have. I think a lot of kids don't outrightly recognize that, bullying is not supposed to be happening. It's kind of almost part of culture right now. So to be able to have a transparent, active conversation between parents and kids and parents and teachers, and being able to create a system where kids feel safe to talk about things like this. If maybe you might be the bully, that's a tough one, because to be able to sit down and recognize like, hey, is this something that I'm doing is wrong, is hard. Especially as Jennifer had mentioned, it might be like an innate, well, not an innate, but it might be a unlearned skill, right? If that's how you interact with people with aggression, then that might be just part of why, like, just be normal for you. So being able to sit back, if you're starting to notice like feedback from your peers that, your interactions are maybe a little bit more aggressive, being able to have that conversation with yourself or with other people, to make changes for yourself, and recognize maybe if there's any unmet needs or skills that need to be learned to be able to maybe communicate more effectively and less with conflict and aggression.
Thank you, Doctor. So we've tackled aggressor, victim, and there's a third point of discussion for tonight, and that's the bystanders. The bystanders are also what we call the witnesses. Kids who witness bullying are more likely to have increased use of tobacco, alcohol, or other drugs, increased mental health problems, including depression and anxiety, miss or skip school. So all negative effects as well, just like with the bullies and the bullied. So why does being a bystander to bullying affect their mental state too? Dr. Sydney.
Yes, great question. I think we forget again, like the people around us that might be witnessing what's going on. And then even for ourselves, if we're witnessing this, we might not totally recognize how it's affecting us. Like I mentioned before, like cyberbullying is so common right now, and it feels almost like normal as part of our interactions online. And as a bystander, again, like you're scrolling and you're seeing these comments and you're thinking like it's this is maybe becoming part of like the norm, and it might influence your own behaviors and how you interact with other people, and might even lower your own values or how maybe you filter how you react to other people, maybe saying things that you don't necessarily say all the time, but you may have seen it happen on the internet or in person, and think that's acceptable. And I'm thinking about just kids in psychology. The brain of a child or a human is not fully developed, what we call executive functioning, where we're able to filter and make more the good and the bad decisions. It's not fully developed until maybe like your mid-20s. So up until then, you're kind of just taking in a lot of information and trying to make sense of it as a bystander. So if you're seeing bullying and trying to understand it, it might not totally be the most accurate understanding. And so again, like being mindful of kind of what information you're taking in, and having that information and being an upstander, right? Being proactive in fighting against it. That would be the next piece in that, in being proactive anti-bully stance, I guess.
Thank you, Dr. Sidney. Jen, let me ask you, as an educator, in your experience as a counselor, how does bullying affect the mental state of the witness? Or have you ever encountered witnesses, bystanders? Have you ever counseled any of them?
Well, actually, if I could share a personal story, when my daughter started middle school, one of the first things she saw the first week of school, she saw someone getting bullied. So she came home and she wasn't sure what to do. She had feelings of guilt that she saw it happen and didn't say anything. But at the time, it was just her, and then there were a couple other students there, so it really wasn't a good time or place to say something and kind of stop what was going on. So she actually witnessed something that was physically happening to another student. So she had come home feeling very guilty about it, feeling very bad about herself, that she didn't have enough courage to be able to stop it. So, I see that as that could be another effect of why bystanders start to feel, depressed or down, is because they have mixed feelings of guilt or of shame that they weren't able to stand up to it. So what my daughter did was she contacted the authorities, she contacted the superintendent, her guidance counselor, and reported what she saw. And the next day she was called into the office, and they told her that they identified the students. They actually caught it on camera, so they did see what was happening. So, they were proud of her. She got an award for standing up to the bullying and for reporting it. So that definitely made her feel better. So, in that sense, there was a positive outcome to this story. But in many cases, some students or some children don't feel that, they have something that they don't have, they don't know what to do. And they're left with mixed feelings, again, of guilt, of shame, or, what if this happens to me, of fear. So that's why there is also very many negative effects to bullying as well for the bystander as well.
I see. All right. Thank you so much, Jennifer, Dr. Sidney. More about the fight against bullying when we come back. This is Eagle News America. Stay with us.
Turuan din natin ang mga bata ng tamang paghugas ng mga kamay. Basain ang kamay ng tubig at lagyan ng sabon. Kuskusin ang iyong mga palad. Gayon din ang pagitan ng mga daliri. Pati na ang likod ng mga palad at daliri. Ganon din ang iyong hinlalaki, kasama ang mga dulo ng iyong mga daliri. Pagkatapos ay iyong kalapulsuhan. Gawin ito ng kahit 20 segundo. Pagkatapos ay banlawan ng tubig at patuyuin.
The search for the best continues. Tagi sa Nagaling Part 2 is now accepting audition entries. Kung ikaw ay 21 to 59 years old at may angking galing sa pagkanta, mapasolo, duet, trio o banda man, magpadala na ng audition entry. Narito ang mga guidelines. Para makapagpasa ng entry sa singing category, contact Nikki sa 0977-651-9504. Ito na ang pagkakataon mo para maging tagisan ng galing grand winner at manalo ng 2 million pesos. Para sa karagdagang impormasyon, i-like ang Tagisan ng Galing Facebook page. Kaya sali na!
This is Eagle News America. I'm Ace Ramirez in Washington, D.C. As adult and responsible members of the community, what proactive things can we do to help stop bullying? Let me ask our correspondents. Let's start with Myla. Myla, what proactive things can we do? How can we help?
Ace, I think it should start at home. I mean, even the way you talk to your husband, the way you talk to your children, even from the siblings. Every time my daughter talks to the way my daughter talks to the youngest, we always make sure that they still respect each other, and even though sometimes they're playful, but we still tell them, like, you know, that's not the best behavior whenever we deal with them. So like I said, it should come, especially from the parents. It should come from us, the way we deal with our husband, the way we talk to our husbands.
I agree. Well, we should educate them.
Yes.
Right. All right. Naya, what do you think? How can we help?
Well, I think that it's always important to, remain supportive and positive with our friends, because you never know what truly is going on in someone's life. So I think that we should always strive to be kind, because you never know if a small act of kindness could be life-changing to someone else.
That's right. That's a very good point. Eli, what are your thoughts?
I think that we should work towards making children of all ages that experience bullying, whether as a victim or as an aggressor or even just a bystander in our previous discussion, we need to make them more comfortable with openly discussing incidents of bullying so that this is more just made known to adults who maybe are staff of schools or even just as parents.
That's right. I agree. Don't shy away from it. Tackle it right away. Mayan.
Ace, I definitely agree with Myla. As a parent, I believe that it starts from the household, the family, the way or the kind of upbringing that we give to our children, the treatment that we give to them, and the treatment that we show to them and each member of the family. Also, Ace, I believe we should always have a close relationship with each member of the family, especially with our kids, so that if and when they experience such or any difficult situation, they would be very comfortable to tell us whatever is happening at school or in other aspects of their lives. Right?
That's very true. The line of communication should always be open. Frendel, what can you say about this?
Hi, Ace. Hi, everyone. Well, I couldn't agree more with all of the correspondence, and I love the facts that our doctor and Jen had given us. Because it really stems from the household, communication is key. And so I feel, even though we know this and we need to be educational with our children, but we have to remember to listen. And because oftentimes as parents, we're so focused on being the parent and we feel like we always know best, but we need to take a moment and be silent and let our children be open and create a very safe space at home so that they can freely open up about whatever is going on in school, online, with their friends. And what I feel is also important that we should all become educated on are the type of questions because of the power of your words. So what questions can we ask our children? What questions can we ask each other? And also, Ace, in our workplace or wherever we are, especially with our friends and family, if we do notice a sign of bullying or someone feeling down, we should definitely acknowledge that so that they are aware of their behavior.
Good points. Good points raised there, friend. We would like to thank our interviews for tonight, Dr. Sydney Fontanares and Ms. Jennifer Polintan, thank you so much for joining us. October is National Bullying Prevention Month, and let us leave you with this message. 1 out of 5 students is bullied, sadly to say. 5 out of 5 can help prevent it. That's a positive. For more information how you can help stop bullying, visit stopbullying.gov. There is strength in numbers. We continue to thank our healthcare workers, our first responders, and essential workers with a round of applause. That is today's Eagle News America. Thank you so much for joining us. I'm Ace Ramirez. We live in interesting times.
Mga kababayan, tulad ng OFW, kasa at biyaya ang gusto sa ibang bansa. Ang iba ay di swerte, bumalik ng walang wala. Hindi mo makikita bakas ng pagduwa.